Hello, and thank you for visiting us at House of Paws Animal Rescue Charity YouTube channel. This is just some information about panleukopenia. It is one of the major diseases that we face at the rescue centre. It kills kittens and cats alike. We have many kittens and cats arrive with this disease and many develop it. This is just some information about the symptoms and the treatment and how we care for the cats that we receive at House of Paws and how we hopefully help them combat this terrible disease. Commonly known as feline panleukopenia, feline infectious enteritis is a disease caused by infection with feline parvovirus. It is sometimes referred to as Panleukopenia virus because one of the results of the infection is the development of a low white blood cell count. The infection is probably the greatest major disease threat to any rescue facility, and infection carries a very high mortality rate, particularly in unvaccinated kittens. In kittens over 3 or 4 weeks of age and in adult cats, the virus causes a very severe gastroenteritis, which causes diarrhea and vomiting. This follows an incubation period of 5 to 9 days. Affected cats develop acute onset hemorrhagic vomiting and diarrhea, that is vomiting and diarrhea which contains blood. And some of these cats, once they are at this stage, can die rapidly. The virus causes severe damage to the lining of the intestine and also travels via the blood to the bone marrow and lymph glands. Viral replication at these sites leads to a marked depletion of white blood cells. Infected cats and kittens usually have a fever and are obviously depressed and will not want to eat. Some cats may even die before showing the signs of gastroenteritis. Pregnant queens infected with the virus can spread this to the unborn kittens, where it can interfere with the developing kitten's brain. So kittens may be born with a condition known as cerebellar hyperplasia. It just means a lack of development of the cerebellum, a part of the brain needed for fine coordination and movement. So when born, the kittens may seem fine initially, but as they start to move and walk, it becomes clear that they are highly uncoordinated and wobbly. It's known as wobbly kitten syndrome. This may also happen in very young kittens, less than 4 weeks of age, infected with the virus, as the cerebellum is still developing at that age. There is no specific treatment for the virus, and it is vital that any suspected cases are nursed in isolation, as this is a highly contagious disease. Protective clothing must be worn and hands washed thoroughly after handling any cat or kitten suspected of having the disease. Affected cats can often die from dehydration and massive secondary infections. So aggressive support with intravenous fluids and broad-spectrum antibiotics are essential. Antiemetic drugs to stop vomiting may help the cats to begin feeding again. Good veterinary and nursing care is vital for these cats, especially the young kittens, if they are going to recover from the disease. There are some interferon and antiviral drugs now on the market that can help this disease, and it can be useful in managing the recovery of these cats and kittens. While there are no specific treatments for panleukopenia in cats, There is a medicine called Feline. This medicine is normally used for cancer treatment. However, this has also been used under vet supervision with some success for panleukopenia. It must be stressed, however, that a vet must supervise this treatment. However, prevention through vaccination is always better than cure. It is the most important thing we can do for our cats that we try and help. Please help us support these cats in their fight against panleukopenia. There are highly effective vaccines available, and all cats and kittens should be vaccinated, including those cats who are indoor-only cats. Control of the spread of the virus relies on both vaccination and good management practice, including disinfection with appropriate disinfectants and use of isolation procedures. When faced with an outbreak of the disease in a colony of cats, vaccinating all the cats will help, and in some countries the serum anti-FPV serum is available that may be given to susceptible cats and kittens to help protect them by providing antibodies against the virus. Don't let your kitten go outside or mix with other cats until they have been vaccinated. The virus can survive in the environment for several months. If your cat has been diagnosed with the virus, don't let them mix with other cats until they are 100% healthy again. The disease is highly contagious, often fatal. It of course affects the immune system and the digestive tracts, as discussed, and it can last for several weeks after the cat has recovered. And they can shed the virus in their feces for at least 6 weeks. Cats who survive the symptoms for longer than 5 days will often recover. However, they do need high-level care during this period, and some cats may die within 12 to 24 hours of infection. Cats who recover from panleukopenia will have lifelong immunity. Please keep supporting House of Paws charity. Please keep visiting our YouTube channel. Thank you very much for listening. We are proud to be an animal rescuer. Thank you.